Welcome to this AJR Insider video. I'm Andy Rosenkrantz, Editor-in-Chief of AJR, and I'm here today with Dr. Wei Yang from MD Anderson Cancer Center, who is editor of our breast imaging section. In this video, she'll be sharing with us her insights about the area. Wei, thanks for joining us.
Pleasure to be here. Thank you, Andy.
Can you tell us about your background in breast imaging?
Absolutely. I was board certified, British board certified in 1994, which is now 30 years ago. And at that time, I was tremendously interested in every subspecialty of radiology, including neuro, musculoskeletal, abdominal, imaging, pediatrics. And the minute I landed in Hong Kong after completing the exam in the United Kingdom, my boss called me in with a wonderful opportunity. And he said, "I've got great news for you. You're going to be leading the new breast imaging unit." That was just amazing news because that was my least favorite rotation. In part, breast cancer at that time in the East was tremendously uncommon. It was about 1 in 24 women. I think it's become more common now. But we had done so little breast imaging and training, and the most common cancers at that time were nasopharyngeal and hepatocellular carcinoma. Fast forward, I got to know the surgeons. At that time, women were having bilateral mastectomies, very little opportunity for imaging women. And I realized quickly that in order for a breast imaging career to flourish, it would be best served by coming to the West. And I landed in the United States in the Cancer Center in Houston, Texas, and everything else is history. So it was a huge relearning opportunity. And I've had the privilege of working with so many talented breast imaging radiologists, but also multidisciplinary breast physicians who've really been huge in helping me move forward in publishing.
So you've really made a great career out of what was not your originally planned path. So let's move on now to the breast section. What trends have you observed for recent AJR submissions in the subspecialty?
Absolutely. After the deluge of articles that came through on COVID, I think that screening in all its forms, vascular and non-vascular based articles, continues to dominate interest. There is also a tremendous interest in what breast imaging radiologists can do to contribute to the conundrum of dense breast and the masking effect, as well as the increased risk. There is huge interest in implementation of best practices in all aspects of breast imaging, additional interest in advancement of new technologies such as contrast-enhanced mammography and abbreviated MRI. And least but not least is artificial intelligence and convolutional networks and how they can contribute to the advancement of breast imaging. I've also noticed a greater interest in the practice of breast imaging internationally, so that's been very encouraging and very insightful.
And what would you see as maybe particular areas of priority for publishing in breast over the coming year?
Absolutely will be artificial intelligence and its impact on all the various aspects of breast imaging, starting with detection and diagnosis. Quality imaging as a supplemental imaging tool for screening, for triage of breast cases. And I think one area that's been significantly underexplored is the value of artificial intelligence in assisting with operational inefficiencies in breast imaging. Additional areas I think would be a priority would be looking at remote working options for breast imagers. That's a slightly more complex issue as compared with subspecialties with axial imaging.
Yeah, so it seems like there are a lot of really good opportunities there for investigators to be working on. So with those areas in mind, are there certain tips that you would have for authors looking to publish their manuscripts in breast imaging in AJR?
There are two main areas I would like to focus on, Andy. I think the first is paying attention to manuscript assembly. A well put together manuscript makes it very easy for reviewers to understand the study goal and the message that authors are intending to communicate to their reader and their audience. And the second point is to create a very clear, specific aim that is supported by well-described method and a strong study design that is concordant with the results that are reported and substantiated by the conclusion that the authors draw. There needs to be a seamless flow using the rubric that we're all very familiar in the world of academic publishing. It needs to flow well, it needs to be logical, and it needs to be very easy for the reviewers and the editorial board to read so that our reader can benefit most and accurately receive the new information that author would like to communicate to their readers.
Those are helpful insights. Beyond those general tips, are there any other common pitfalls that you're seeing in submissions?
I think the biggest issue that we encounter is a very well thought through hypothesis or goal with a weak study design that reflects perhaps inadequate thought before embarking on the study, before determining whether the study population is appropriate for the goal. A second common pitfall is a well-designed study, but lack of clarity in description of the methods, which creates a lot of questions for reviewers and leads to lack of trust in the integrity of the data. The third common pitfall is when results are scattered and not well collated either in the text, not organized, and perhaps inadequately described in the tables. So a cohesive flow that reflects logical and incremental thinking, starting from the aim of the study to the conclusion, is something that I feel is very relevant to our readers and that would help our reviewers view the manuscript positively.
These will all be important items for authors to keep in mind as they're polishing off their manuscripts before submission.
Yeah, one helpful element, I think, as the authors review their manuscript, I think that rereading it many times is helpful. I think just zooming out and trying to think of the absolute clinical impact and how relevant this is to practice so that the paper that is published is truly novel. It may be on a topic of great interest. The value in the next publication is shining a light on an angle that is different from everything else that has been published. So something that is novel and less incremental, I think, is going to be a huge positive for authors considering submission of a new manuscript.
Anything else that you'd like for listeners to know?
I think that it's important to share on this forum that the entire editorial board, I know that you and I truly enjoy discussing good submissions that come through, as well as the reviewers. I want to thank the reviewers for their stellar and remarkable insights. They are very meticulous in reviewing every single aspect of the manuscript. And I want to tell the readers that every manuscript that is submitted is of great value. The insights and the experiences that the authors have shared help to increase our learning environment, as well as the learning pool for the entire community, both in the academic world as well as in community practice. So I just want to give a loud shout out to all the authors who submit papers to AJR and to tell them that we appreciate them as they keep coming.
Wei, thanks for joining us.
Thank you, Andy.